Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without delay, let's get started.
The nurse in the intensive care unit is giving a report to the nurse in a cardiac step-down unit about a client who had coronary artery bypass surgery. Which of the following is the most effective way to assure essential information about the client is reported? 1. Give a report face-to-face with both nurses in a quiet room. 2. Audio tape the report for future reference and documentation. 3. Use a printed checklist with information individualized for the client. 4. Document essential transfer information in the client's electronic health record. The correct answer is 3. Using an individualized, printed checklist ensures that all key information is reported. The checklist can then serve as a record to which nurses can refer later. Giving a verbal report leaves room for error in memory. Using an audio tape or an electronic health record requires nurses to spend unnecessary time retrieving information. The nurse is teaching a client and his family about the client's new diagnosis of hemochromatosis. Which of the following details should the nurse include? 1. Hemochromatosis is an autoimmune disorder that affects the HFE gene. 2. Individuals who are heterozygous for hemochromatosis rarely develop the disease. 3. Individuals who are homozygous for hemochromatosis are carriers of hemochromatosis. 4. Men are at greater risk for hemochromatosis. The correct answer is 2. The nurse should teach the client and family that individuals who are heterozygous for hemochromatosis rarely develop the disease. Men and women are equally at risk for hemochromatosis, but men are diagnosed earlier because women do not usually have manifestations until menopause. Hemochromatosis is the most common genetic disorder in Canada and the United States. Individuals who are homozygous for hemochromatosis receive a defective gene from each parent. Those with homozygous genes may develop the disease. The nurse is planning care for elderly clients who are affected by orthostatic hypotension. The nurse should do which of the following? Select all that apply. 1. Assist the clients to stand to help prevent falls. 2. Teach clients how to gradually change their position. 3. Request a prescription for antihypertensive medications for clients at high risk. 4. Conduct fall risk assessments. 5. Consider the use of sequential compression devices for high-risk clients. 6. Place clients on bed rest. The correct answers are 1, 2, 4, and 5. Orthostatic hypotension is a drop in blood pressure that occurs when changing position, usually to a more upright position. Orthostatic hypotension often occurs in elderly clients, and it is a common cause of falls. Nurses must assess clients for orthostatic hypotension and assist all clients with orthostatic hypotension in standing to help prevent falls. Lower limb compression devices aid in prevention of decreased orthostatic systolic blood pressure and reduce symptoms in elderly clients with progressive orthostatic hypotension. Nurses must teach clients how to gradually change their position, and they must conduct fall risk assessments. Sequential compression devices may be helpful to high-risk clients and should be considered when developing the care plan. Antihypertensive medications are not necessary for clients with orthostatic hypertension and may precipitate dangerous drops in blood pressure. The client should be encouraged to be ambulatory. The nurse should instruct a young female adult with sickle cell anemia to do which of the following? Select all that apply. 1. Drink plenty of fluids when outside in hot weather. 2. Avoid being in high altitudes. 3. Be aware that since she is homozygous for hemoglobin S, she carries the sickle cell trait. 4. Know that pregnancy with sickle cell disease increases the risk of a crisis. 5. Avoid flying on commercial airlines. The correct answers are 1, 2, and 4. The nurse should teach the client to drink plenty of fluids to avoid becoming dehydrated. The client should avoid being in high altitudes, such as mountains above 5,000 feet, where there is less oxygen in the air, which may precipitate a sickle cell crisis. The nurse should alert young women with sickle cell anemia that pregnancy increases the risk of a crisis. People who are homozygous for hemoglobin S have sickle cell anemia The heterozygous form is the sickle cell carrier trait. A client with sickle cell anemia may fly on commercial airlines. The airplane is pressurized and has an adequate oxygen level. A client with peripheral vascular disease has chronic, severe pretibial and ankle edema bilaterally. Because the client is on complete bed rest and circulation is compromised, one goal is to maintain tissue integrity. Which of the following interventions will help achieve this outcome? 1. Administering pain medication. 2. Encouraging fluids. 3. Turning the client every 1 to 2 hours. 4. Maintaining hygiene. The correct answer is 3. The client is at greater risk for skin breakdown in the lower extremities related to the edema and to remaining in one position, which increases capillary pressure. Turning the client every 1 to 2 hours promotes vasodilation and prevents vascular compression. Administering pain medication will not have an effect on skin integrity. Encouraging fluids is not a direct intervention for maintaining skin integrity, although being well hydrated is a goal for most clients. Maintaining hygiene does influence skin integrity, but is secondary in this situation. The nurse is administering packed red blood cells to a client. The nurse should first 1. Discontinue the IV catheter if a blood transfusion reaction occurs. 2. Administer the PRBCs through a percutaneously inserted central catheter line with a 20-gauge needle. 3. Flush PRBCs with 5% dextrose and 0.45% normal saline solution. 4. Stay with the client during the first 15 minutes of infusion. The correct answer is 4. The most likely time for a blood transfusion reaction to occur is during the first 15 minutes or first 50 milliliters of the infusion. If a blood transfusion reaction does occur, it is imperative to keep an established IV line so that medication can be administered to prevent or treat cardiovascular collapse in case of anaphylaxis. PRBC should be administered through a 19-gauge or larger needle. A peripherally inserted central catheter line is not recommended in order to avoid a slow flow. RBCs will hemolyze in dextrose or lactated ringer solution and should be infused with only normal saline solution. A client who has been diagnosed with peripheral vascular disease is being discharged. The client needs further instruction if she says she will. 1. Avoid heating pads. 2. Not cross the legs. 3. Wear leather shoes. 4. Use iodine on an injured site. The correct answer is 4. The client should avoid using iodine or over-the-counter medications. Iodine is a highly toxic solution. An individual who has known PVD should be seen by a physician for treatment to avoid infection. The client with PVD should avoid heating pads and crossing the legs and should wear leather shoes. A heating pad can cause injury, which, because of the decreased blood supply, can be difficult to heal. Crossing the legs can further impede blood flow. Leather shoes provide better protection. In a postoperative client, the hematocrit decreased from 36% to 34% on the 3rd day, even though the red blood cell count and hemoglobin value remained stable at 4.5 millions per microliter and 11.9 grams per deciliter, respectively. The nurse should next 1. Check the dressing and drains for frank bleeding. 2. Call the physician. 3. Continue to monitor vital signs. 4. Start oxygen at 2 liters per minute per nasal cannula. The correct answer is 3. The nurse should continue to monitor the client because this value reflects a normal physiologic response. The physician does not need to be called, and oxygen does not need to be started based on these laboratory findings. Immediately after surgery, the client's hematocrit reflects a falsely high value related to the body's compensatory response to the stress of sudden loss of fluids and blood. Activation of the intrinsic pathway and the renin-angiotensin cycle via antidiuretic hormone produces vasoconstriction and retention of fluid for first 1 to 2 days post-operatively. By the 2nd to 3rd day, this response decreases, and the client's hematocrit level is more reflective of the amount of RBCs in the plasma. Fresh bleeding is a less likely occurrence on the 3rd postoperative day, but is not impossible. However, the nurse should have expected to see a decrease in the RBC count and hemoglobin value accompanying the hematocrit. A client with peripheral vascular disease has bypass surgery. The primary goal of the plan of care after surgery is to 1. Maintain circulation. 2. Prevent infection. 3. Relieve pain. 4. Provide education. The correct answer is 1. Maintaining circulation in the affected extremity after surgery is the focus of care. The graft can become occluded, and the client must be assessed frequently to determine whether the graft is patent. Preventing infection and relieving pain are important, but are secondary to maintaining graft patency. Education should have taken place in the preoperative phase and then continued during the recovery phase. The nurse is assessing a client's activity tolerance by having the client walk on a treadmill for 5 minutes. Which of the following indicates an abnormal response? 1. Pulse rate increased by 20 beats per minute immediately after the activity. 2. Respiratory rate decreased by 5 breaths per minute. 3. Diastolic blood pressure increased by 7. 4. Pulse rate within 6 beats per minute of resting pulse after 3 minutes of rest. The correct answer is 2. The normal physiologic response activity is an increased metabolic rate over the resting basal rate. The decrease in respiratory rate indicates that the client is not strong enough to complete the mechanical cycle of respiration needed for gas exchange. The post-activity pulse is expected to increase immediately after activity, but by no more than 50 beats per minute if it is strenuous activity. The diastolic blood pressure is expected to rise, but by no more than 15. The pulse returns to within 6 beats per minute of the resting pulse after 3 minutes of rest. The nurse is instructing a client who is at risk for peripheral vascular disease how to use knee-length elastic stockings. The teaching plan should include which of the following? Select all that apply. 1. Apply the elastic stockings in the morning. 2. Remove the stockings if swelling occurs. 3. Apply the stockings while in bed. 4. Once the stockings have been pulled over the calf, roll the remaining stocking down to make a cuff. 5. Keep the stockings in place for 48 hours and reapply using a clean pair of stockings. The correct answers are 1 and 3. Elastic stockings are used to promote circulation by preventing pooling of blood in the feet and legs. The stocking should be applied in the morning before the client gets out of bed. The stocking should be applied smoothly to avoid wrinkles, but the top should not be rolled down to avoid constriction of circulation. The stocking should be removed every 8 hours, and the client should elevate the legs for 15 minutes and reapply the stockings. Clean stockings should be applied daily or as needed. A woman of African descent had experienced severe palpitations, weakness, and shortness of breath after taking bacitracin. As a part of the discharge planning, the nurse should evaluate the client's knowledge about 1. Increased folic acid needs. 2. Congenital enzyme deficiency. 3. Restricted activity in hot weather. 4. Need for blood transfusions. The correct answer is 2. This client presented with the typical signs of glucose 6-phosphate dehydrogenase, aka G6PD, deficiency anemia. 10% of blacks inherit an X-linked recessive disorder of the G6PD enzyme in the red blood cell. When cells with decreased levels of G6PD are exposed to certain drugs, such as sulfonamides, acetylsalicylic acid, thiazide diuretics, and vitamin K, the RBC may hemolyze and anemia and jaundice may occur. The reaction is self-limited as soon as the causative agent is withheld. No further treatment is necessary except counseling to prevent acute incidents by avoiding exposure to specific drugs. There is no need for increased folic acid, restricted activity in hot weather, or blood transfusions. A client is scheduled to undergo right axillary to axillary artery bypass surgery. Which of the following interventions is most important for the nurse to implement in the preoperative period? 1. Assess the temperature in the affected arm. 2. Monitor the radial pulse in the affected arm. 3. Protect the extremity from cold. 4. Avoid using the arm for a venipuncture. The correct answer is 4. If surgery is scheduled, the nurse should avoid venipunctures in the affected extremity. The goal should be to prevent unnecessary trauma and possible infection in the affected arm. Disruptions in skin integrity and even minor skin irritations can cause the surgery to be canceled. The nurse can continue to monitor the temperature and radial pulse in the affected arm. However, doing so is not the priority. Keeping the client warm is important, but is not the priority at this time. A client with pernicious anemia asks why it is necessary to take vitamin B12 injections forever. Which is the nurse's best response? 1. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient acid. 2. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient intrinsic factor. 3. The reason for your vitamin deficiency is an excessive excretion of the vitamin because of kidney dysfunction. 4. The reason for your vitamin deficiency is an increased requirement for the vitamin because of rapid red blood cell production. The correct answer is 2. Most clients with pernicious anemia have deficient production of intrinsic factor in the stomach. Intrinsic factor attaches to the vitamin in the stomach and forms a complex that allows the vitamin to be absorbed in the small intestine. The stomach is producing enough acid. There is not an excessive excretion of the vitamin, and there is not a rapid production of red blood cells in this condition. One goal in caring for a client with arterial occlusive disease is to promote vasodilation in the affected extremity. To achieve this goal, the nurse should encourage the client to 1. Avoid eating low-fat foods. 2. Elevate the legs above the heart. 3. Stop smoking. 4. Begin a jogging program. The correct answer is 3. Nicotine causes vasospasm and impedes blood flow. Stopping smoking is the most significant lifestyle change a client can make. The client should eat low-fat foods as part of a balanced diet. The legs should not be elevated above the heart because this will impede arterial flow. The legs should be in a slightly dependent position. Jogging is not necessary and probably is not possible for many clients with arterial occlusive disease. A rehabilitation program that includes daily walking is suggested. A client with vasospastic disorder, Raynaud's phenomenon, is considering having a sympathectomy. This nurse should tell the client that the surgery is performed 1. In the early stages of the disease to prevent further circulatory disturbances. 2. When the disease is controlled by medication. 3. When the client is unable to control stress-related vasospasm. 4. When all other treatment alternatives have failed. The correct answer is 4. Sympathectomy is scheduled only after other treatment alternatives have been explored and have failed. Medication and stress management are beneficial strategies to prevent advancement of the disease process. If the disease is controlled by medication, there is no reason for surgery. The client has aching, weakness, and a cramping sensation in both of the lower extremities while walking. To promote health and maintain the client's level of activity, the nurse should suggest that the client try 1. Cross-country skiing. 2. Jogging. 3. Golfing. 4. Riding a stationary bike. The correct answer is 4. In this case, the exercise prescription needs to be individualized because walking causes discomfort. To maintain the level of activity and decrease venous congestion, riding a stationary bike is another appropriate exercise behavior. Use of a stationary bike provides a non-weight-bearing exercise modality, which allows a longer duration of activity. Jogging and cross-country skiing are weight-bearing activities. In addition, cross-country skiing involves a cold environment, and maintaining warmth is essential in promoting arterial blood flow and preventing vasoconstriction. Golfing is a good activity, but it is not typically considered an exercise that causes aerobic changes in the body. When giving discharge instructions to the client with vasospastic disorder, Raynaud's phenomenon, the nurse should explain that the expected outcome of taking a beta-adrenergic blocking medication is to control the symptoms by 1. Decreasing the influence of the sympathetic nervous system on the tissues in the hands and feet. 2. Decreasing the pain by producing analgesia. 3. Increasing the blood supply to the affected area. 4. Increasing monoamine oxidase. The correct answer is 1. Beta-adrenergic medications block the beta-adrenergic receptors. Therefore, the expected outcome of the medication is to decrease the influence of the sympathetic nervous system on the blood vessels in the hands. Beta-adrenergic blockers have no analgesic effects. Increasing blood supply to the affected area is an indirect effect of beta-adrenergic blockers. They do not increase monoamine oxidase, which does not play a role in Raynaud's disease. The client with peripheral vascular disease has been prescribed diltiazem. The nurse should determine the effectiveness of this medication by assessing the client for 1. Relief of anxiety, 2. Sedation, 3. Vasoconstriction, 4. Vasodilation. The correct answer is 4. Diltiazem is a calcium channel blocker that blocks the influx of calcium into the cell. In this situation, the primary use of diltiazem is to promote vasodilation and prevent spasms of the arteries. As a result of the vasodilation, blood, oxygen, and nutrients can reach the muscle and tissues. Diltiazem is not an anti-anxiety agent and does not promote sedation. It also does not cause vasoconstriction, which would be contraindicated for a client with peripheral vascular disease. A client with Raynaud's phenomenon is prescribed diltiazem. An expected outcome is 1. Decreased heart rate, 2. Conversion to normal sinus rhythm, 3. Reduced episodes of finger numbness, 4. Increased SpO2. The correct answer is 3. Calcium channel blockers are first-line drug therapy for the treatment of vasospasms with Raynaud's phenomenon when other therapies are ineffective. Cardizem relaxes smooth muscles and improves peripheral perfusion, therefore reducing finger numbness. Cardizem decreases heart rate and is used to treat atrial fibrillation, but these are not associated with Raynaud's. When vasospasms are prevented, an accurate SpO2 can be measured in the affected extremity. However, SpO2 is a measurement of systemic oxygenation not influenced by cardizem. A client is receiving pentoxifylline for intermittent claudication. The nurse should determine the effectiveness of the drug by asking if the client 1. Has improved circulation in the legs, 2. Can wiggle the toes, 3. Is urinating more frequently, 4. Is less dizzy. The correct answer is 1. Although pentoxifylline's precise mechanism of action is unknown, its therapeutic effect is to increase blood flow, and the client should have improved circulation in the legs. The client does not have nerve impairment and should be able to wiggle the toes. Urination is not improved by taking pentoxifylline. Dizziness is a side effect of the drug, not an intended outcome. In order to prevent recurrent vasospastic episodes with Raynaud's phenomenon, the nurse should instruct the client to 1. Keep the hands and feet elevated as much as possible. 2. Use a vibrating massage device on the hands. 3. Wear gloves when obtaining food from the refrigerator. 4. Increase coffee intake to 2 cups per day. The correct answer is 3. Loose, warm clothing should be worn to protect from the cold. Wearing gloves when handling cold objects will help prevent vasospasms. Vibrating equipment and typing contribute to vasospasm. Tobacco and caffeine should be avoided. Elevation will decrease arterial perfusion during vasospasms. A client with peripheral vascular disease, coronary artery disease, and chronic obstructive pulmonary disease takes theophylline 200 milligrams twice daily every day and digoxin 0.5 milligrams once a day. The physician now prescribes pentoxifylline. To prevent problematic adverse effects, the nurse should monitor the client's 1. Digoxin level, 2. Partial thromboplastin time, 3. Serum cholesterol level, 4. Theophylline level. The correct answer is 4. Pentoxifylline can potentiate the effects of theophylline and increase the risk of theophylline toxicity. Therefore, the nurse should monitor the client's theophylline level. Pentoxifylline does not interact with digoxin. Pentoxifylline can interact with heparin, and the client's PTT would need to be monitored closely if the client were taking heparin. It does not affect cholesterol levels. The nurse should instruct a client who has been diagnosed with vasospastic disorder, Raynaud's phenomenon, to 1. Immerse the hands in cold water during an episode. 2. Wear light garments when the temperature gets below 50 degrees Fahrenheit. 3. Wear gloves when handling ice or frozen foods. 4. Live in a cold climate. The correct answer is 3. Extreme changes in temperature can precipitate a vasospastic episode and should be avoided by clients with vasospastic disorder, Raynaud's disease. The client should be encouraged to wear gloves when handling frozen foods or ice. The client should immerse the involved extremity in warm water during an episode to promote vasodilation and relaxation of the small arteries that are in spasm. The client can help prevent vasospasm brought on by temperature changes by wearing warm clothes. Living in a cold climate will exacerbate the symptoms. A client with a history of coronary artery disease has been diagnosed with peripheral vascular disease. The physician started the client on pentoxifylline once daily. Approximately 1 hour after receiving the initial dose of pentoxifylline, the client reports having chest pain. The nurse should first 1. Initiate the rapid response team. 2. Contact the physician. 3. Encourage the client to relax. 4. Document the episode in the chart. The correct answer is 2. Angina is an adverse reaction to pentoxifylline, which should be used cautiously in clients with CAD. The nurse should report the client's symptoms to the physician, who may prescribe nitroglycerin and possibly discontinue the pentoxifylline. The client should rest until the chest pain subsides, and documentation is essential when a client experiences an adverse reaction with medications that have been prescribed. However, the nurse's top priority is to call the physician, report the problem, and obtain a prescription for nitroglycerin. The client's reports of symptoms should never be dismissed.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.